Well, hi, everybody. Thanks for joining me. Chief Rodriguez is here. I'm here with Marc Kruse, and we wanted to talk a little bit about the pandemic and what's happening right now, and just basically how to take care of ourselves during this situation. It's getting hot outside. This pandemic is going and going and going. It's just continuing on. We're having to take extraordinary measures to protect ourselves, wearing PPE, which is even tougher as it gets hotter. And then there's that constant pressure and worry about, getting infected, taking it home, all these other things that can happen. So I thought it'd be a good idea just to spend a few minutes and talk to Marc a little bit, and just to help us get through this and give us some tips about how we can survive and stay healthy and stay well during this whole pandemic situation. So Marc, you've been here a little while with us now.
Yeah.
Before we get started, why don't you tell everybody a little bit about your background and how long you've been here? Tell us where your heart is. Where are we with you?
Yeah, so I joined the city of Austin in December of 2011, so coming up on 9 years now. Prior to that, I worked at the VA, where I worked with returning war veterans primarily, who were experiencing difficulties with alcohol and with trauma exposure and traumatic brain injuries. I originally got my PhD at UT Austin. I'm originally from San Diego, born and raised in Southern California, and like every other person from California, they seem to have been leaving that state and coming to different ones. So my wife and I moved here in 2000, and then we have 3 kids, and I really joined the city of Austin to work with EMS and the fire department because I've really had a lot of respect and admiration for what our first responders do for our communities. I know personally that I don't think I'd be able to handle what it is that you do for us in the communities, but I have a lot of respect for what you do and want to help out however I can.
Well, that's great, Marc. I think you have to have a special heart to do what you do, because we kind of do what we do, and we don't give it a second thought, at least not immediately. And we need somebody that stands behind us, that's willing to help us through, get some of the tough stuff. And so let's get started. I've got a few questions, if that's okay.
Right.
So I've been a paramedic for a while, and ultimately that's my training. That's what I do. And I certainly understand how seeing horrific things can affect us and our well-being and our mental status over time. But a pandemic, how does that affect us? What can that do, or why does it affect us in any way particular?
Yeah, absolutely. In many ways, we're probably more likely to experience negative mental health effects from this long-term and widespread pandemic that we're experiencing with COVID than oftentimes we are from a single particularly bad or difficult call. And there's really a number of reasons why I think so many of us are currently being affected by COVID, but perhaps the most obvious reason is that as opposed to a bad call or a difficult situation at work that primarily affects us within that aspect of our lives, it seems like COVID is having a significant impact on just about every single aspect of our lives. We see some of our folks being impacted financially, and for some people, it's losing out on a secondary source of income from a part-time job. Some of us have had significant others who have either lost their jobs or they've seen their hours cut. Some of us, the significant others, have had to voluntarily leave their jobs in order to take care of our kids. And for other people, we even see folks kind of having to reconsider their retirement options based on concerns about the stability of our economy and concerns that there may be another widespread shutdown. And obviously, in addition to the financial impact, we've seen people impacted really socially, which has a huge effect on our overall well-being. Because, we're trying to do the best we can and to follow the best guidelines and practices and social distance from one another. But what that ends up doing is it ends up significantly reducing our opportunities to really spend time and meaningfully connect with some of the most important people in our lives. We've also seen a huge impact recreationally in terms of restrictions on our ability to go out and do some of those things that we enjoy, whether that's working out in gyms, which has kind of reduced capacity, or playing sports, both of which we know offer really wonderful benefits to our mental health and well-being. We haven't really been able to kind of go out to movies with friends or attend concerts, or have social gatherings and game nights with the people we're close to, or even something as simple as going out to a restaurant or a bar with our significant other. COVID has really, in a lot of ways, created some unusual obstacles to many of the self-care activities that we really benefit from. And of course, if we're being completely honest, because this pandemic isn't just affecting our first responders who are out there serving the community, we're seeing a huge impact on our family lives. Despite our best efforts, most of our significant others and many of our kids are likely also experiencing some of the negative effects of the pandemic and the disruption that it's caused in their lives. And this can really be important for a number of reasons. One, many of us are experiencing kind of additional pressure to try to make sure that the most important people in our lives are doing okay. Or we might find it frustrating that despite everything we're trying to do to make everything okay, we're seeing that the people that we care about the most are still having a hard time. And another reason why this is difficult is that when our significant others are feeling stressed, or they're worried, or they're anxious, or they're depressed about what's going on in the world, it really reduces their ability to effectively provide the support and comfort that we may need from them.
Well, that is a lot to think about. You mentioned quite a few things there that really touched home with me. Recently had our 35th anniversary, Mark, can you believe that? And we couldn't do anything. We just stayed home and watched TV and had ice cream. That was our 35th anniversary celebration a la COVID. But I think part of that, just to get past that, we said that next year we'll do a double. And so we'll celebrate a little extra next year to make up for that. Some of the things that you mentioned, the way that we're being impacted personally and the way that we're being impacted within our family structure and our social structure, those are big deals, because a lot of those things are the things that become part of our definition of who we are.
Yeah.
And I'm sure that there's all kinds of feelings that people are feeling right now. Some of it might be just anxiousness, just feeling anxiety over what's going on. Some of it might be just feeling angry and frustration.
Mm-hmm.
When the social thing is being impacted like it is now, and we're limited in the things that we can do, then there's loneliness that can come in as well, and then sensing loneliness from others. So a lot of that stuff is weighing on folks. We may not realize it though. So what are some things that we should be on the lookout for? How do we know that it's time to go ask for help? Should we do some things proactively? Should we monitor ourselves differently? How do we know?
Yeah, so you're really hitting the nail on the head with a lot of those examples that you're using, and it's probably safe to say that every single one of us, and not just every single one of us who works for Austin Travis County EMS, but really every single one of us that's kind of existing in these times, is at least in some way reacting to the stress of what's going on. And many of the signs and symptoms that we're experiencing are pretty similar to the traditional signs and symptoms associated with stress, anxiety, and depression. And if we think about it, generally there's three broad categories of symptoms that we kind of look at and that we experience. The first of these are kind of the broad physical symptoms, and this might include things like noticing increased headaches, people who experience migraine headaches, that they might be experiencing them more common or for longer periods of times, increased muscle tension, and I know a lot of people like to go, and part of their self-care is going to get a massage, and that's not an option right now. Some people might be experiencing some increases in just GI difficulties, or changes in our appetite, or the amount or the types of food that we find ourselves craving. Changes in energy levels, or feeling fatigued, and of course the biggest one, which is changes in our sleep patterns, and how we know we just know how important it is, and how much disruptions in our sleep can affect not only the way that we feel physically, but the way we feel mentally as well. The second broad category of symptoms that I would want people to think about are what we consider to be the traditional psychological or emotional symptoms. And these can include anything from really very specific concerns and feeling anxious about either becoming infected with COVID, or for a lot of our folks, what they're expressing are concerns about potentially passing COVID on to loved ones, and especially if they have important people in their lives who are immunocompromised or in some way at a higher risk for any other reason, as well as just generally feeling overwhelmed by everything that's going on in our world and feeling powerless to either control it or to reduce the negative effects it may be having in our own lives. These can also include some of the more subjective symptoms that are associated with depression, like feeling sad or feeling discouraged about what's going on. Noticing reductions in how much you're enjoying activities that usually make you happy, or finding yourself maybe not particularly motivated to go out and do those types of things that you usually enjoy. And unfortunately, these emotions can also lead into changes in our thought processes, where we find ourselves focusing on really the negative aspects of our lives, or thinking negatively about ourselves or maybe the people that we love the most. The third broad category of symptoms that people can kind of look at are some of the more behavioral manifestations of things that are going on. Obviously, once again, this can include those changes in sleep, which are a real obvious factor in how we feel. But it may also include difficulties with concentration or decision making. It may involve people withdrawing from others, and this can be physically or emotionally or both. But the idea of becoming more isolated than what's usual for you. We may also see increases in drinking, or maybe spending an excess amount of time playing video games or watching movies as a way to kind of disconnect from what's going on. Certainly those can be fun activities in the right context, but too much of it kind of removes us from being actively involved with our lives. And of course, a big one that people often experience, and part of the reason why we're seeing an increase in people reaching out for help, is that the irritability and kind of lower frustration tolerance that we have is starting to blend over and affect our relationships at home and even our relationships with coworkers.
Well, I was talking to a friend recently, and he was very pessimistic. His view of the world, normally he's very positive, but he was being very negative. And I was kind of caught off guard with that. I just called to see how he's doing. And we talked for a little while, and after listening to a very long and detailed, very pessimistic perspective, I was kind of stumped. I didn't know what to say. We've been friends for 15, 16 years. And so I thought about it for a second, and I said, well, tell me something good that happened to you. Is there anything positive that you can share with me? Give me some good news. And that entirely changed the conversation. We talked about our hobbies. We talked about projects that we're working on. He does woodwork, so do I. So we talked about things that we had in common. And I think at the end of that phone call, both of us felt better. He wasn't as pessimistic as he was at the beginning, and he had gone through some positive thoughts with me. And I think he had an opportunity to just dump some of that stuff. And so I think that was a good opportunity as well. So thinking in that vein, do you have any tips for us? Any things that might be good for us to try to help ourselves as much as possible? Any good things that we should be practicing?
Yeah, absolutely. And while, we know in general there's some things that just about all of us benefit from, I also want to take the time to point out and recognize the fact that each of us are really our own self-experts. So woodworking for you might be great. I would probably lose a finger or two if I tried that. So that might not be very effective for me. But we really want to encourage people to really think about and practice those self-care activities that have been the most effective for them. But if we're talking about kind of putting together a list, there's some things that I'd encourage everybody to consider. And one of them is related to kind of what your friend was talking about and him being in really kind of in a really negative place. So regarding the pandemic and COVID and all that stuff, while it's really important to stay informed, to the extent possible, I'd really try to encourage people to try to minimize their exposure to the overly negative sources of information or maybe the highly sensationalized stuff that's going on. And regardless of where people stand politically, I just don't think it's good for anybody to spend multiple hours of time sitting in front of CNN or Fox News or MSNBC, or even multiple hours of scrolling through Facebook if your feed kind of includes a lot of those negative stories. It's just not beneficial for folks to kind of get wrapped up in all the negativity. And it can really overload and affect the way that we think about the world. And if those thoughts are negative, it bleeds over into affecting the way that we feel. So whatever your source of information that you feel comfortable with, we want you to engage with it long enough to get the information that you feel you need, and then try as quickly as you can to get out. And so you don't have those kind of negative inputs, because like you experienced with your friend, it can really affect us. Second, I'd encourage people to do whatever they can to take care of themselves physically. And this includes things not only like healthy eating, some form of exercise, keeping drinking to a level that it's not causing negative consequences for either you or your relationships, and of course getting good sleep. And you mentioned earlier that it's hot outside. And so I know that exercise is difficult. Access to gyms is restricted. It's like 1,000,000 degrees outside today. But we want to encourage people to be creative and to give yourself permission that even a small step towards increasing your physical activity is a positive step in the right direction. So whether it's going for a walk, whether it's getting up early, whether it's doing push-ups at home and trying, one of those push-up challenges, just something to kind of get yourself physically engaged, it's a good thing. Third, I think I'd really encourage people to really be creative and to try to find ways to continue to engage. Or maybe if they found themselves isolating, to make steps to re-engage socially and safely with others. Some people really need a lot of social engagement. I'm someone who really tends to be very social, so I spend a lot of time talking with people, and that's good. And sometimes at the end of the day, that means I don't want to talk to people. But talking with clients is different than having like an active social life. And so if people need a lot of social engagement, that's great, but this isolation might even be harder on them. And so it may be important for them to really be proactive in trying to organize kind of social activities, whether that's going for a walk with a friend, or a run with a friend, or whether that's reaching out and setting up, Zoom happy hour things, or setting up kind of an outdoor kind of a meal where people can spend time with each other in a safe place. That probably is going to be important too. And other people I know prefer less social engagement, and they might benefit from even being proactive and kind of reaching out to people via text. Like a lot of the clients that I work with, they don't really want to spend time talking on the phone, but it's good to check in over text. And so even sending people funny memes, or send up group text where you can make fun of each other, sometimes that could be a way to kind of re-engage socially, given that there's so many restrictions are in place. So wherever people are on the spectrum of their own social needs, it's important that we make those efforts to reach out and to get that connection, because we're not getting a lot of opportunities spontaneously right now. And I realize that this is a big fourth category, but the most important thing, I think, is to encourage people to engage in the self-care activities that have been most effective for them in the past, or maybe even to consider trying something that they haven't done in the past, but maybe they want to. I have several clients who are taking this time to learn to play a new instrument. I know several people are working on improving their Spanish, or getting educated in different things. I know a lot of people are starting to take kind of online classes, and looking at ways to kind of advance themselves. Some people who are really into meditation are working on trying to improve those skills. Other people who don't have that involved in their lives are maybe considered introducing some mindfulness stuff into their daily lives. But whatever it is that you do for self-care, it's really, we just want to make sure that you're doing things that after you do them, it's leaving you feeling refreshed and ready to re-engage with the world. And if possible, if you have significant others in your life that you can pull into those activities, and that's great to do as well, because then not only are you engaging in self-care for yourself, but you're really building those connections with those important people and getting some of the social pieces as well.
That's really good. I'd like to comment about we're our own experts, and I think that's so important. We know ourselves very well, and I think this gives us the opportunity to think about what works for us and how to leverage those things as much as possible, so that we can maintain our own health and take care of ourselves. But I know that from time to time we do need help. We need someone to talk to. We need somebody to help us restore the balance that we need to pursue. How do we get help? With COVID and stuff, it's really hard to get face-to-face with folks. Are you doing anything different to help people maintain contact with you, or or anything like that?
Yeah, so I am spending a lot of time on my cell phone, and if you saw the email that went out over the weekend, my cell phone died, so I'm getting a brand new cell phone tomorrow, which will hopefully help and will survive. But I'm spending a lot of time on my phone. I'm spending a lot of time texting with people. I'm spending a lot of time on Zoom meetings because sometimes it's helpful to have that kind of at least visual connection. I am sometimes coming in and seeing people in my office as well, if that's their preference. We're trying to do everything we can to be respectful about the social distance rules and all of those things, to wear a mask. But one of the great things about this department is I think that you've done a really good job of putting together a multitude of resources so that kind of no matter what somebody's needs are, there's something that's available for them. We have an incredible peer support team with some just really great people that are on there. If you want to reach out to a colleague, and to get the support that maybe only somebody who also works in EMS can really provide for you. We have myself and Dr. Ebony Butler, who both serve as staff psychologists here, and we're available to provide confidential and no-cost counseling services for you and your significant other, because we know this is having an impact on relationships too. The department also has a contract with Tanya Glenn's group, and she's available to provide resources, and members of her team are available to provide mental health counseling for folks. We have resources available through our insurance, Blue Cross Blue Shield, our employee assistance program with Deer Oaks. It's not the same as just having people come in hour after hour and sitting together face to face, but we're really a group of people who are dedicated to taking care of our folks, and we want to help however we can. So if somebody is experiencing difficulties, I encourage them to reach out to anybody in that group or outside resources as well to get the help that they could really benefit from.
Well, Mark, I'm very thankful to have a peer team that is responsive as it is, and they do their best to answer quickly and to address needs as quickly as possible. We're in the process of setting up a peer team alert system so that when they identify a situation that needs to be handled quickly, that the right folks get notified quickly, and we can activate ourselves to take people off shift or do things that whatever it is that they need so that we can not waste any time and get them the help as quickly as we can. I'm very appreciative of you and your colleagues for being available, especially now when all of this is happening all at the same time, and the situation changes daily by minute sometimes.
Yeah.
And we're doing our best to keep up. Our department certainly is committed to trying to support everyone who's a member of the department and their families as much as possible to maintain resilience so that we can bounce back, because we know that we get hit with things, and it's normal to respond and react to those things. But how we bounce back, I think, makes all the difference in the world. So I just want to say thank you again for everything that you do, and all your colleagues as well, and all the support that you give us. And I very much appreciate you taking time out of your busy schedule, because I know you're swamped, and then trying to do it without a phone. So thank you for taking the time today to spend a few minutes with me, and hopefully folks will look at this and they may have questions. And folks, if you do have questions about anything, feel free to reach out. We'll do our best to get answers for you. You can email me directly if you'd like, or you can contact Mark, and either of us will try to work on whatever it is that you need that we can provide support for.
Yeah,
so Mark, anything in closing?
Just I would encourage people to not feel like you have to wait until you're in crisis to reach out, to even if you just want to check in, even if you just kind of want an opportunity to kind of share what's going on and to kind of get your own self-care kind of jump started. That is certainly a valuable use of our time. And like I said, we are here for you. That's why we are here doing this job. So do not feel like you have to wait till you're in crisis to reach out. And then if you scroll all the way down to the end of the sit reps that Chief Gardner and the department send out every day, it has the phone numbers for peer support and myself and Dr. Butler and Tanya. So every day you're hopefully getting an email that has that contact information on there. And like I said, please feel free to reach out if there's anything we can do for you.
That's excellent, Mark. I appreciate your time, and we'll be catching up with you later. Thank you.
Okay. Thanks, Chief.
See you later.